Hello, and welcome to Looking Forward, the last in a series of webinars focusing on evolving crisis standards of care and ongoing lessons from the COVID-19 pandemic. This series is hosted by the National Academies of Sciences, Engineering, and Medicine, and sponsored by the Forum on Medical and Public Health Preparedness for Disasters and Emergencies. Next slide, please. I'm Eric Toner, a senior scholar at the Johns Hopkins Center for Health Security, and I am the chair of the planning committee for this webinar series. Next slide. And I'd like to deeply thank the members of the planning committee listed here who've worked so hard over the last several months to make this possible. Next slide, please. We have several objectives for the webinar today. First, to reflect on the challenges and opportunities that were presented and discussed during the previous webinars, to articulate potential opportunities to enhance crisis standards of care and the framework and guidance that are needed for planning, activation, implementation, and evaluation and monitoring, and to suggest focus areas for potential future research on the issues related to crisis standards of care. Next slide, please. So our agenda for today is, after these opening remarks, we'll have a keynote address followed by considerations of staffing and workforce issues. We'll then have a 10-minute break right before 1 o'clock Eastern time. We'll come back at 1 for a discussion of presentation and discussion of the planning and implementation webinar. And then following that, a discussion and presentation discussion on legal, ethical, and equity considerations that were discussed in previous webinar. This will be followed at the end by some reflections and then some closing remarks. At the very end, we'll finish by 2:15 at the latest. Next slide. So I think at this point, I think it's time for me to turn it over to Kelly Shank, to give us some instructions on logistics.
Good morning, everyone. I'm delighted to provide you with information about how you can participate in this session. First, on the live stream screen at the upper right-hand corner, there's a phrase troubleshooting tips. Click on that to get tech support regarding the live stream or Q&A functions during this session. We encourage all audience members to engage in this discussion. Please submit your questions in the Q&A box below the live feed. Please provide your full name and affiliation each time you ask a question. Speaker bios will not be read in full, but they've been provided in the meeting materials posted on the website along with an agenda for today. This webinar is being recorded. Workshop proceedings, which is a reasonably accurate and objective summary of what occurred at the workshop, will be authored by the National Academies at the conclusion of the webinar series. The workshop proceedings may contain viewpoints attributed to individual participants or groups of participants in the workshop. Eric, I'll hand it back over to you.
Thank you, Kelly. And can we have the next slide, please? So for our keynote address, we will have remarks by Chris Hassel and Rick Hunt from ASPR. Dr. Hassel is Senior Science Advisor and Deputy Assistant Secretary for Preparedness and Response at ASPR HHS. And Richard Hunt, MD, is Senior Medical Advisor for the National Healthcare Preparedness Programs at ASPR. And with that, I think we'll be starting with Chris. So Chris, over to you.